October brings with it a critical reminder. It's Breast Cancer Awareness Month. Did you know this disease affects 1 in every 8 women right here in Canada? Now, here's a crucial fact. Women with dense breasts, they're looking at a 4 to 5 times higher risk of getting breast cancer compared to those with less dense breasts. Until recently, after a mammogram, you wouldn't necessarily hear about this. Now, take a look at this graph. It's showing more provinces, including the most recent addition, Ontario, stepping up to inform women about breast density. This is good news, but there's still ground to cover. Let's bring back to the panel. Dr. Gorfinkel, until recently, mammograms were basically normal or not, and now we're being given, depending on where you live in the country, extra information that could quite literally save your life.
Absolutely. Breast density is something the best doctor cannot feel on an examination. So you can't touch the breast and know how dense it is. That is a mammographic finding. And why that's so crucial is because it can hide a breast cancer. Glands, which create breast density, look white on a mammogram. And guess what? That's the same color as cancer. So looking for a white cancer on a white background of dense breasts is really hard to do. And yet, it's a major risk factor for developing breast cancer.
But is this information, Dr. Jacobson, that a woman should know? I mean, you start to get into how much information should you be telling people, and you don't want to overwhelm them or concern them. But how relevant is this information for a woman to know?
Well, as Dr. Gorfinkel said, breast density is a mammographic finding. So women would only know if they had dense breasts once they've already had their first mammogram. And in most provinces, that's going to be at 50 years plus. So this isn't something that you would disclose when you were under 50. But in Ontario, if this is identified that your breasts are over 75% dense, that's actually going to change the frequency of breast screening, where there's going to be a recommendation to have annual breast mammograms rather than once every 2 years.
I do want to get into that because right now mammograms are happening at 50, but in the US, they've changed the guidelines to 40. But just quickly, Jane, do you know how dense your breasts are?
I do have dense breasts, and I have been getting mammograms every 2 years since I was 40.
And so have you known that information since you started getting mammograms?
Yes, I have, and I think it was as a result of my family doctor reading me the results of my very first mammograms. And I began getting them at 40 because there is a lot of cancer in my family history. So my doctor thought it would be a good idea, and so I've been for many, many mammograms now.
How about what's happened in the United States? They've lowered that age, and should Canada follow suit?
Right. It is a complex thing that requires an individualized conversation with the person. Not all women necessarily want that to happen. The guidelines, at a minimum, should offer that, though. And that's a big problem because that means screening a lot more women. The crux of the issue is under 50, breast cancer is far less common. So we're going to have false positives. But those cancers also tend to be more aggressive. So we're screening more people to find fewer problems that are potentially more aggressive. Not all women necessarily want to walk that path. But there's no question that if caught early, it can make a big difference in survival.
But then how else are women to know whether or not they have dense breasts if they don't have a mammogram?
So young women are going to have dense breasts. It's only after the change of life that our estrogen levels fall and the glandular tissue goes down. And that's part of the problem with screening lots of young women. It's actually harder to detect cancer on their mammograms. Their breast tissue is going to appear more white. And remember, cancers look white, so you're looking for white on a white background, which can be difficult.
How about self-exams, Dr. Jacobson? What should women know about that? Is it something that we can perform ourselves?
First of all, just to your point previously, I think it's important to note that Alberta has recently dropped the age of mammography, where they're going to be starting at 45 now. So this is a change that we're already seeing in Canada. In terms of self-breast exam, this is something that's been recommended in the past, but not always shown to be effective in finding breast cancers early. I do think in my experience that there's a lot of value in women knowing when there is a change and being able to detect that change and then bring it to hopefully their family doctor. The other thing I'd just like to bring up is you said, how will we know if our breasts are dense? But breast density is only one of a myriad of risk factors for breast cancer. So what I would encourage women to do is have an assessment using some sort of a validated calculator to determine what factors they have that predispose to breast cancer. And it so much goes beyond family history.
What are some of those factors, Dr. Jacobson?
It can be your lifestyle in terms of exercise, as having a sedentary lifestyle, obesity, alcohol intake, age at first pregnancy, age at menopause, age at first period, first-degree family history, other cancers in the family. Different calculators take all sorts of different factors into account, but they've actually been shown to be effective at predicting breast cancer risk. And when breast cancer risk is highly elevated, you actually qualify for high-risk breast screening, which is different than routine screening.
We've been talking about how men and women experience different maladies in different ways. Now, men, although rare, also can get breast cancer. Are there differences in the way that those symptoms present?
Often they present much later. First, there's a taboo against men touching breasts and even coming and saying, I'm worried I could have a breast problem. Many men don't realize that any breast lump, any change, is significant and requires consideration about what it could be. And yes, men can get a mammogram. Yes, men can get breast ultrasounds. But ultimately, if there's a lump which feels hard, irregular, especially if it's fixed to the skin or fixed to the chest wall below, we're talking the ribs and muscle, it's not moving, that has to get a biopsy independent of what those show.
It's interesting, when I was a younger woman, there was a lot of emphasis around checking your own breasts every month after your period. It seems as though that isn't the push anymore for women, and that your breasts are checked, but at your physical with your doctor, and then when you go for your mammogram.
Mm-hmm. And yet, 4 out of 5 breast lumps are discovered by women themselves. The messaging has been mixed, and it's difficult.
And that is key. Remember to check yourself again and again and trust your intuition. We'll be right back.